Hello, this is Dr. Stephen Anthony, medical doctor and consultant. You're about to hear one of our interviews on the pathway to the Canadian Residency Program. Thank you for taking the time to listen to this interview, and I hope you find it very useful. If you want to find out more about our services and resources that can help you get a high score in the MCCEE, MCCQE, and USMLE exams, then go to canadaqbank.com. Today I'll be interviewing Dr. Walid Barake, who is a third-year resident in internal medicine at the Queen's University, which is located in Ontario, Canada. Dr. Walid Barake will be sharing his insights and tips about the Canadian residency matching, the Carms pathway, tips for taking the North American exams, tips for medical students and physicians who want to enter the Canadian medical system, the LMCC certificate, PG specialties that are easy to get into in Canada, tips for matching into difficult specialties in Canada, IMG friendly provinces, Toefl and IELTS scores, preparation tips, residency interview tips, and much, much more. We recommend that you take a lot of notes during this video series. The information shared in these free videos will improve your chances of securing a medical residency position in Canada. So let's get started. So, hi Walid, can you hear me?
Hi, yes, I can hear you very well, Stephen. Thank you everyone for listening.
So, thank you, Dr. Walid, for taking the time to be here and also for your preparation for this call. And I think it will help a lot of people, especially because the Canadian system is somewhat complex. And the thing that you've been through it already and you have blazed the path, it's really helpful that you are here.
Yeah, absolutely. It's my pleasure.
So, where are you originally from? Are you a Canadian and
no,
or are you an?
No, I'm not. I'm an international medical graduate. I graduated from Beirut, from Lebanon. I'm a permanent resident in Canada, so I got matched as an IMG.
So, you had finished your bachelor's, is it, or your postgraduate?
That's right. My bachelor in medicine and surgery.
So, how was it that you moved from Lebanon to all the way to Canada?
I applied for immigration, and the main reason for my immigration was because of my wife. My wife is Canadian; she lives here, and she encouraged me to join her. So I applied, and I moved, and we're now living together here.
Oh, that's great! That's great. So, how much time did it take you from start to getting into the residency program?
I should say I was lucky to get matched from the first iteration of the Carms that I applied to. So it didn't took that much. I graduated in summer 2010, and I moved into Canada the same summer, just after a month of graduation. And I started my Carms application that summer, and I got matched that iteration. So by July 2011, I started my residency.
Wow, that's almost like a fairy tale.
Right. So yeah, one of the things that I did prepare for it ahead. So I started on my paperwork and exams during my medical school, which made things very, which I should say, easier for me.
So, what exams did you give before applying to Carms?
So, at the time of application, I did take the MCCEE, I did take the MCCQE Part 1, and USMLE Step 1 and Step 2 CK.
Okay, so by that time you had already cleared it by 2000.
Right, that's right. And then during my application, by the time I finished, I did take the CS, and I got the ECFMG certificate, and then I took the Part 2 of the qualifying exam during my residency.
Great. So would you say that taking the USMLE actually helped you get into the residency? Was it considered?
Absolutely. That's what I would like to try to emphasize on this talk. They, on the Carms website and everywhere, they don't tell you to take the USMLEs. But really, if you have the USMLEs, you definitely have an extra point. You definitely have something special. because the licensing exam are um, the best standardized way to evaluate IMGs, and I think that's the one of the important things that program directors and committee look at it and evaluate applicants, and these exams definitely help. So I really recommend to take both exams if possible, like the Canadian licensing exam and USMLE, and try to take them in a fashion where you can get the best of everything. So like when you're applying to MCCEE, apply to Step 2 CK, for example, at the same period of time. That's what I did. When you're applying to the part 1 of the qualifying exam, you can also take the Step 2 CK if you haven't done it yet, or and with the CS, try to take the part 2. I think it's very important.
Okay. So the preparation would go hand
exactly,
in hand.
Exactly. I found it, it's very, very similar preparation material, and really there's only just some, fine tuning, just a little bit of change. But if you study for one exam, you can take the other exam at the same period of time. For example, I took the MCCEE and the Step 2 CK the same week, actually, like Tuesday and Thursday, because and I took 99 on the CK and 99.5. I don't remember the 3-digit number for the MCC. So I think it's very useful to do that.
So, I mean, looking at your case, it would mean that you had given the USMLE very early in your medical schooling.
Yeah, right? So during medical school, I took the Step 1.
During which year did you get
it? I did it, so my bachelor was a 6-year program. So I did it at the end of my 4th year. So after I finished the basic science part, the first after I finished the 3 years, so it's the basic science time.
Right. So that's where you move to the clinical aspect.
That's right. So after a year of kind of clinical application of the basic science, I took it. Yeah. So I think it's very good to try to to take the Step 1 early on, like in medical school, maybe if not medical school, early after graduation, but not to postpone it, because if you don't take it early on, it's gonna be a little bit hard to review all the basics with the although it has big part of clinical application, but still it has a big bulk of basic science, and that's what's sometimes hard for applicants. And
And you had actually taken the USMLE Step 2 and MCCQE in the final year of
the EE, the evaluation exam. And the final year of medical school, and in 1 week.
Okay. Right, great. So coming back to the core matter of the interviews, let's say that I'm looking at some of the questions we had prepared. Where would one have to start for the Canadian licensing exam? Yeah,
so it's a good question. I mean, the best way to start, is to probably, in my opinion, to start, look for the system that you're going to. So if you want, to practice in Canada, you should start, surfing the webs, especially the Carms website, which is www.carms.ca, and have some idea about the basic and provincial requirements for residency programs, and to get an idea about what they want from you and what are the qualifications, so you can start working on that and do that early, like as early as possible, as you decide to go to Canada or to immigrate or whatever.
So how early can this be? Can this be in the 3rd year of fourth year of
definitely, third year is as early as possible. So 3rd year is probably a good time to do that if you know that you're going to immigrate or you're going to be somewhere in North America. But it's never too late. Even if you're in IMG, you have graduated a few years ago, and you decided to do that, you can definitely start doing that, and it's not hard. And after looking at the websites and ask people who got matched here and people who then the Physicians Apply website is the new website where you can where all your credentials can be verified. It was formerly known as the PCRC, or the Physician Credentials, but now it's physiciansapply.ca. That's the new website. And get your paperwork verified, because sometimes it will take some time, like weeks, and to get your credentials verified, like your MD degree, your transcripts, your exams and stuff like that. So it can be shared all over Canada when you apply to the Carms. And
Right. So if I have to differentiate here, I mean, if let's say we have two situations here. One is a medical student in the third year of medicine, and the other one is the international medical graduate who's already finished his medicine. So how does this process differ? I mean, what would they do on carms.ca, and what would they do on physiciansapply.ca in both the cases?
So to be honest, for the medical students who's in his third year, I don't think there is much on the carms.ca, because there's still enough time to take the Carms. But for example, for a third year medical school, the best thing to do is to study for the exams. Just study and prepare well for the exams and try to get high scores. They don't tell you that high scores are very important, but they look at, and program directors and they comment on it. They will say, "Oh, I'm impressed by your scores." So they actually look at them. So if you're a medical student, start studying for the exams. And since you're in medical school, you have a privilege to do an elective, which you will lose once you're a graduate. You can, go to Canada, have do an elective, or go to the States, do an elective, which is very important for your application, especially if you can get a reference letter during that. Once you graduate, you're on with Observership, which is okay, but not as good as the elective.
So what would you suggest? How long should the elective be?
I mean, as long as possible, even if it's one block, a month or a couple of weeks. Any kind of exposure to the Canadian system or to the U.S. system is very important for your CV and for your application. They want something to trust you as an international medical graduate, and I think the licensing exams and elective a letter of reference from a Canadian attending staff, these things I think will make them trust this person who's coming from different system more.
So we didn't really define the Carms. So a person who's just starting out in this process of getting into Canada, what would you say? How would you define the Carms website?
So the Carms, and I have this definition from the Carms website, and it's the Canadian Resident Matching Service. It's basically a non-profit organization. It provides electronic application service and the computer match for entry into the postgraduate medical training throughout Canada. Carms also supports access to the U.S. electronic application, what's called as ERAS. So you can apply through Carms to both Canada and U.S. residency programs.
Great. So the ideal time to register on Carms would be when?
So they post every year different timetables. So it varies from year to year. But it's the application starts in usually in August for first year. But sometimes it starts earlier or later. So it's always good to start during May or March, or just start to see how things are and just check the timetable. But it's usually August. That's the first iteration.
let's say that the physician who's completed his medicine from another international medical college, for him it's straightforward. They got to go and apply for the Carms. What about the medical student who's still in their third or fourth year? Should they wait until they finish their MD and they get their certificate in hand to apply for the Carms?
So, I believe they can apply during their final year, but it's a little bit tricky, a little bit hard, especially if if you don't have all the qualifications yet. So you can. So the question is, if you can, yes, you can. If you have your MCCE and you're in your final year, you can apply. It's a little bit hard though, a little bit tricky, but it seems to be working for some international medical schools that are not too far from Canada, like in the Caribbean or in Ireland, so they can go back and forth for electives, for interviews. For some of them, it does work, yeah. But it's not an easy thing to do. But if you can start, early on in your exams and everything, you can definitely apply. And if you go to the Carms website, all what they need, your MCCE, but again, it's different from province to province. Some province want you as an IMG to have an MD, like graduated. Some provinces will say, okay, final year or graduate. So it depends. Always just see where you're applying to which province and prepare ahead.
Right. So to get into the residency program, either in US or Canada, you don't need an internship, right?
No, you don't need. No, you don't need. No. I didn't do an internship, and I did very well in my residency. You don't really need it. No. And the first year, the PGY1 of internal medicine, whatever specialty you're applying to, is basically an internship. So your first year, you're an intern. So you're gonna be an intern anyway. So I don't think you need it. I mean, it's good if you want to get some more experience. If you want to prepare for your exams is better than just wait at home. But it's not necessary. It's not mandatory.
Yes, it's the same rule applies even for USMLE, I believe.
That's right, definitely. The only advantage for in my opinion, for doing an internship after your medical school, like at your home medical school, is that you can take the part 2 basically, MCCQA part 2, so you can get the LMCC certificate, which can help you on your application. If you have the LMC certificate, that's I think probably the only advantage.
Perfect. So coming to the second part, the physiciansapply.ca, how would you define that website?
So it's just like a renovated website. When I applied, I used the PCRC, and they transferred all my documents to the Physician Apply. But it's basically a website that holds credentials for physicians. So it's like it's like a directory where all physicians' credentials are there and they're verified. So let's say you have your MD, you can send your MD, a copy of your MD, like a certified copy to them, and they will verify it. So it will take a few weeks, but once it's verified, it's verified. So it's a credential that it's like a register of credential where if you apply for Carms, if you apply for maybe a job one day for an attending staff, or for any hospital maybe in Canada, it's verified, so they can you can share this with the physician apply, and you don't have to provide every time like your certified copy of MD. It's there, it's in the system, so it makes things easier for IMGs and physicians in general. Yeah.
It's something similar to what ECFMG does for USMLE.
Yes, yeah, it is similar, yeah, because ECFMG, and even I remember on the PCRC they did verified my MD degree through the ACFMG. So they're linked together somehow. They work together or something. But yeah, it's basically the same. Yeah, same idea.
Okay. So coming to the next part of the interview, we've covered the studying part and what is Carms. That's something you just went over. And can you apply to Carms immediately after MCCE?
Yes, absolutely. Yeah. So if in some provinces, in some provinces like Quebec, they want you to have the part 1, and but in some provinces, it's all what you need is your MCCE. But to be honest, it's not very realistic to apply with the MCCE. The match is getting more and more competitive year after year, and there is the more qualifications you have, the higher your chance of getting matches. I don't think it's realistic to just apply with the MCCE. Because other people will have more exams, more qualifications, but you can you could apply, but it's your chance I think will not be that high.
Right. What you said is very interesting. I mean, considering that it's getting very competitive. Right. Let's say that a doctor or an international medical graduate applies for Carms after the MCCEE, that is after finishing their medical school. Right. And they don't get into the residency program the first year. So they decide to continue with the post-graduation in their own country.
Okay.
Now, let's say after finishing their post-graduation, they have only their MCCEE. Would that be an added advantage of having a post-graduation for the matching? Or
you mean like they have a training, like a residency training outside plus MCCE? Yeah, I mean, it's definitely helpful, but I think my impression. The more qualifications you have from North America, the more they can trust you to go into the system, and the more the more your application is. Postgraduate training outside is definitely helpful, and they will look at it. But you need to support that with some standardized
examinations.
Yeah.
Right? So we covered the top part, which is the physician credentials registry.
Yep.
That is the physicians apply part, and then you take the MCCEE.
That's right.
And then you suggest that the next step would be taking the NAC OSCE.
Yeah, that's right. So I didn't take the NAC OSCE, but some people did, and for some people it did help them. So any standardized exam again is from North America is gonna help you on your application. Medical Council of Canada qualifying exam, USMLEs, the NAC OSCE, anything that can that's any licensing exam from North America will help your application for sure. So I would recommend taking a NAC OSCE. I didn't take it, but it's another standardized exam from Canada, and it's definitely helpful.
And what about the MCCQE Part 1?
So again, it's if you can take it, and I really recommend that you take it as soon as you could. It's very helpful. It will definitely give you a better chance of getting matched.
Right. So, one of the points you made was that applying to the Carms with just the MCCE is not realistic.
I don't think so.
And
yeah,
you would recommend that whenever you're going to apply, you better have the MCCE plus MCCQE Part 1.
Yeah.
And preferably, if possible, NAC OSCE.
Yeah, and if you have some USMLEs on board, absolutely, yeah. I don't want to recommend this, so people will just do exams for a couple of years and then apply. No, I really encourage any person who's eligible to apply. Even if you don't, even if you have the MCCE and you applied, you didn't get accepted, I mean, that's fine. It's an experience for you, and you can learn from it. It's a little bit hard to apply just for MCC with the MCC. I mean, if you for example, let's say you have done couple electives during your medical school in Canada, let's say, and you got some good letter of recommendations. So then I would apply with only the MCCE, because if I'm a final year medical student and I've done a couple electives, I have good reference letters from Canada, then I would apply. But if I don't have other credentials with the MCCE by itself, I think it's hard to get into the system.
Let me give you a few combinations here. Tell me what you think about it. I know, I mean, this is just your personal opinion,
That's
right. But how you feel about it? We discussed about only MCCE, it's not realistic. What about only MCCE plus MCCQE without any North American experience?
That's totally fine. I've seen IMG is getting matched without any clinical experience in Canada or North America. But with good licensing exams, like with a good MCCE marks and with good MCCQE1, and they got in. So really it's not a requirement to have Canadian exposure, but if you have it, it's better.
So the basic thing that you would advise is do your MCCE plus MCCQE and then apply to Carms, and that's where your opportunities would basically
That's
start.
right. Yeah, I think so.
Right?
I think so.
Okay.
Especially if you don't have other stuff on board, like as you said, like elective or whatever. But if you don't have any Canadian clinical exposure, I think MCCE and qualifying exam part 1 to start, and if you have more qualifications, that's better. But I think that's where you can start.
And in your experience, you have seen doctors, IMGs with only MCCE and MCCQE Part 1 get through.
That's right. I definitely did. Maybe they have USMLEs as well. But with only qualifying exams, I have seen IMGs getting in without any prior electives or observerships. But at least MC and QE1.
Okay, so the next thing that you could add to your resume would be, if possible, would be the NAC OSCE.
Right.
That would even improve your chances. All right. So let's look at another situation. Let's say that you're looking at a doctor immigrating from one of the countries, and let's say it's a physician in their 40s or somebody who's been practicing for a long time. So they wouldn't really have their touch with their first year subjects. So the USMLE is out of question because you're not really in touch with your first year subjects. You cannot give USMLE part 1. And let's look at a situation where they're trying to immigrate to Canada. So in that case, what we could recommend would be an MCCE plus MCCQE part 1.
Plus any USMLE that they can take, like step 2 CK. You don't have to take the step 1 to take the step 2 CK. You can just apply to step 2 CK. So I would recommend for that example is for the physician to apply to do the MCCE, the QE1, and if possible, the USMLE step 2 CK and the CS. I'm not sure if the CS he would be able to take the or she would be able to take the CS, but the step 2 CK for sure. You don't need to have step 1 to take the exam, and as well the NAC OSCE. So any exams that he's eligible to take, then he can take. And remember, for a person who has been practicing for 4 years, so he has clinical, he has more than 1 year of clinical experience, so he can also apply for the part 2 and get the LMC certificate. So that would be ideal if this physician can get the LMCC certificate. I think his chance will get much higher than having 1 or 2 exams and just applying with that.
So the part 2 would be the MCCQE.
That's right, the MCCQE part 2.
Okay, so you would say complete MCCQE Part 1, Part 2, and get the LMC certificate.
That's right.
And that would improve the
Especially
chances.
for a physician who has been practicing, for years outside Canada. As you get um, away from the time of graduation, it becomes harder. So you need to impress them and have more qualifications. I guess than younger physicians to get matched. Yeah.
So what is the LMC certificate?
So LMC certificate is the medical license of the Medical Council of Canada, the LMCC. It's the certificate offered by the licenses of Medical Council of Canada once you take the as an IMG, the MCCEE first, then the QE1, and then the QE2, and you must also have 1 year of clinical experience, which is an internship or GY1 somewhere or whatever. It's it's a very prestigious certificate, and they will definitely pay attention to it if you have an LMC certificate. It will definitely make a difference on your CV. Yeah.
I know for a fact that if you are going to practice in USA, even if you're a postgraduate from any other country, you need to still go through the residency program. Is it the same for Canada as well?
Yes, I believe so. Yeah, there is. I'm not very familiar with that, but there was some pathways where you can work in the rural areas, of Canada, where if you have only like couple years of experience, so you take the exams and you go through some sort of short, like a short training program. But I think it's this option is getting less popular. Is getting less popular and not very easy to go. Like one of my colleagues, one of my fellow graduate was trying to do that, and then he found it very hard, and maybe they're not taking residents at the moment. I think the program was in Newfoundland, but I shouldn't be talking about this because I'm not familiar with this program. But yeah, there was a way to do it, but it's I think it's only Newfoundland, and it's rural areas, and but yeah, definitely the preferred way is residency, because you will get certified. You can practice anywhere in Canada after you finish. And in my opinion, the licensing exams are probably the most standardized way to evaluate IMGs, and that's what they look at. It's one of the standardized way of evaluating IMGs. And some people will tell you, oh, just pass the exam, don't worry about the score. Maybe for some program directors, but for some other program directors, high scores matters. So aim to score high, no matter what they tell you. Aim to score high, because residency, in Canada is getting very competitive, and high scores would make you very appealing for program directors and for the residency committee. For some programs, maybe not, but for some others, for sure, high scores are important. So just study well and aim to score high, and that would be the best way to look at it.
And take as many North American exams as possible.
Definitely. It's a little bit expensive, but if even if you had to take, maybe loans or something, if you can, taking more exams, you will not lose anything. They're going to be in your credentials. So even if you can get into the match maybe with less exam, but it's better to take as many as you can. It's always a good credential for you, and they will be there and help you maybe in applying to fellowships after you get into residency. So you'll never lose if you take more exams.
Right. So when you are applying for residency matching, is there a segregation between? I know for a fact that you are not a Canadian, right. So does the factor of being a Canadian come into the picture? Like, do they give more seats or more residencies to Canadians? Or
I don't think it would make a big difference. But I've noticed, if you have some family reasons or personal reasons to come back to Canada, they will appreciate that, and especially on interviews, I think it would make a bit of difference. If you're Canadian, you're born in Canada, and you went away to do your MD, and now you're coming back to join your family. They would definitely consider that. So I think it is an extra point for some people, especially when you're trying to join your family again and you went only for medical school out. They will definitely consider that and give that applicant an extra point on his application. Every year on the Carms, they post from previous years how many IMGs they took, how many CMGs, but every year at the time of the application they will say, like, let's say for internal medicine, each program will say how many spots they are taking roughly. So we're taking, let's say 15 Canadian medical graduate for internal medicine, and we're taking 3 or 4 IMGs. But I cannot just throw out numbers because it depends on the program, depends on the specialty, and so forth.
Right. Okay. So the next question would be, what is CFPC or RCPSC certification, and when do you go for the certification? How do you get it, and how is it helpful?
Yeah. So really, as an applicant to Carms, you don't need to worry about these exams at the moment, because these are exams that you do after you finish your specialty. So the CFPC is the College of Family Physicians in Canada, and it's the licensing exam, or what they call the Canadian Board exam, for family doctors, and the RCPSC is the Royal College of Physicians and Surgeons of Canada, and it's the licensing exams for other specialties. Again, it's like the Canadian board for these specialties, and these exams you take them, once you finish your specialty or in the final year of your specialty, but you cannot take them earlier. So there's no point of having headaches because or thinking about these exams at the moment. But basically, these are like the full certification exams, or the board exam that you take, and once you take them and you pass them, you can start practicing anywhere in Canada, like as an attending staff. You can do locums, you can do part-time or maybe full-time, and so forth.
So this is a compulsory exam that you have to give after
residency. Yes, that's right. So it's in Canada it is, in Canada it is. In the States, I think that the board exams are for some specialties optional, but the Royal College certifications are mandatory. But you don't need to worry about them because they don't affect your application. You cannot even take them at the moment at your application, so you have to be in the system, and it's something to think of after you get matched. So
what PG specialties are easy to get into, and what specialties are tough for IMGs?
It varies from year to year, but it's obviously harder to get matched to a specialty that takes few positions every year. But the highest chance would be going to family medicine, because they take the biggest number of spots. So family medicine is probably the easiest for IMG. Followed by internal medicine, gen surg. Gen surg, family medicine, pediatrics are more or less similar. Lab, pathology, and then when you go to surgical subspecialties and radiology and stuff like that, it's probably the hardest because they take only few numbers. But again, if it varies from year to year, and even if it's difficult specialty, if you really want it, and if you're well prepared, you can get in, even if it's 1 or 2 spots. You can, if that's what you want to do in life, you can do it. Maybe not from the first application though, but you can do it later on. And one of my colleagues.
I mean, what is the difference? Yeah. Like, what makes the difference?
You mean like on the specialty itself?
Yes, I mean, if you had to crack into a tough specialty.
Yeah, so one of my colleagues wanted urology, for example. There were only few spots. He didn't get matched from the first application, but he worked on it. Like he he spent the whole year of trying to do research with some urology people and get good letter of recommendations from them, and published, a couple papers, and then he got matched, but he worked hard for it, and he stayed.
So he had done this in North America.
That's right. Yeah, in Canada. Yeah, and in one of the hardest provinces to get in. But that's what he wanted. He waited, but he was working on it like for a couple of years. So it took him like 3 years to get matched. But that's what he wants. So if he wanted maybe to go to family, probably it would probably be easy to get from the first application. But that's what he wanted, and you can do it even if it's a difficult one, and that's one of the examples, one of my colleagues, and he got it finally.
So how did he support himself for these 2 years?
It is hard. It is hard. So I think I'm not sure exactly how he did that, but I think he relied on his parents. And I think that's how they support him, because I don't think he was able to work because he was doing, trying to do some research, trying to work on his finish up his exams and stuff. So in each province there is some like a student loan or IMG's loan, or I should say like immigrant loan or immigrant funding. So there is some I should say organization that, like a non-profit organization that can loan you, but it's hard. It's lots of expenses, and it's not an easy thing to do. I agree. I should say there's like 3 categories. I should say it's hard to say it like this, but that's how I think about it. Family is probably the easiest. Surgical subspecialties is the hardest, and in between there is pediatrics, internal medicine, pathology, lab, psychiatry. But that's how because it depends on the numbers of spots. Like ophthalmology is hard, dermatology is super hard because they take only a few spots. Like in each province, maybe they take like 3 or 4 dermatologists, so it's definitely hard.
And family medicine is a 4-year specialty?
No, so family medicine is only 2 years. Yeah, it's only 2 years, and after the 2 years, you can start your own practice and work in a clinic or do locums or whatever, but you can do an additional year, like it's like a subspecialty kind of thing in the family medicine. So you can do like family emerge. So it's 3 years if you do family emerge. So you can work in emergency departments and then urgent care centers and do some locums here and there. You can do like family women's health. So you can deliver babies in rural areas and look after women's health and clinics as well. Do like some gynae stuff and pap smears and stuff. So it's so this is and you can do like family other specialties that I cannot recall, but basically you can do only 2 years and start practice as a family physician, but you can do an additional year, but I think it's 3 years the maximum. 2 or 3 years,
So as I understand that different provinces in Canada operate on different rules and regulations. So how is it different?
Right. So it is different. There's some basic requirements that is common to all provinces, but each province has additional criteria. I really recommend that to check the Carms website and to go like R1 match and then go to Provincial requirement and see what each province is requiring. Because there is certain requirements, and for IMGs, some provinces request more or additional requirements to be eligible to practice. However, in all provinces, if you get matched as a resident, when they take you as a resident, so they will, when you finish your training, you get certified and you'll be able to practice in, almost everywhere in Canada. Quebec is a bit special. Sometimes they have more, additional steps, but always, check with the licensing exams. But, if you get matched somewhere in Canada, you can basically work after you finish anywhere in Canada. That's the general rule.
Right. So there is, for an IMG, they do not need to focus on a specific province, or there isn't any province that is easier to find a match.
Yeah. Yeah. So my answer will be a bit biased because I got matched in Ontario, but that's the general feeling, and it's not only based on feeling; it's based on previous match statistics. Ontario has been the most IMG friendly. With the least barriers in front of the IMGs, and with the highest number of accepted applicants. There are many residency programs in Ontario, and it's probably one of the easiest. Like, for example, I'm just gonna give an example for like language requirement. For other provinces, they want like 100 on your Toefl and other stuff. Like in Ontario, all what you need is, if your language of instruction during your medical school was in English, you just need to print out from the FAMER website. It just you go to FAMER and you print that FAMER paper that shows that your language of instruction was in English, and that's it. You don't even need to take Toefl, for example, for Ontario if your language of instruction was in English during your medical school. But so that's like one of the examples, and they take the main bulk of the IMGs in Canada. So I think they're the most IMG friendly at the moment.
So, for example, for USMLE, you need to apply to a lot of residencies to be called for an interview. How many schools did you apply to, and what would you suggest? Again, Carms is extremely competitive. Apply everywhere. Don't just, and if you have your USMLEs, apply to the states as well. And it's based on your preference. Some people will say, oh, no, I just want to stay in Ontario. I don't want to go anywhere else. I'm just gonna keep trying here, and it's okay. It's reasonable. But in my opinion, apply everywhere. Apply everywhere because there's no guarantee that you're gonna get matched in a province. It's a match. It's not easy. Apply everywhere. Okay, so off the top of your head, as an IMG, what are the 3 to 5 provinces that you definitely would not miss out on? Like you would surely apply to these provinces.
Ontario, for sure. Ontario, for sure. There's no doubt. And then look at the Carms website and go to programs and see what's the IMG quota. So go like let's say you want to be an internist, you want to be cardiologist, you want to do internal medicine. Go to internal medicine specialty and go to to program description, and then go to each school in each province and see how much IMG quota they have. Like in some years, British Columbia takes a big number of IMGs, and then you should probably apply to it. And again, it depends year after year, but so far, Ontario has been the most IMG friendly in my opinion.
What about additional exams like TOEFL and so on? What other exams do you?
You want to apply to everywhere in Canada, so you need to be eligible for almost everywhere in Canada. For Ontario, we said like for TOEFL, for example, you don't need the TOEFL, like the TOEFL if the language of instruction is in English. But for other provinces it is. So you should take it and to be eligible to apply, because in some provinces they will just decline your application just because you don't have TOEFL, even if you are a superstar in medical school and you took all the exams, you're super qualified. They will disregard your application if you don't have, like, let's say a 96 on your TOEFL, or like some requirements in each section, like on speaking or on listening. So you should definitely prepare for the TOEFL. Don't forget your licensing exams. You should focus on the licensing exams, and take the TOEFL. If you don't get a good mark, you can repeat it. It's fine. But the most important is your licensing exams, in my opinion.
So IELTS is not valid in Canada, is it?
The IELTS?
Yes,
It is. So you can either, I think, take the TOEFL or the IELTS, or so it depends province by province. But yeah, the IELTS is recognized. Yeah.
Okay. So, what materials would you suggest for preparation?
So to be honest, I know many IMGs, I know many medical students and many physicians, and each person has his own way of studying. For myself, and that's what I really found, and I really recommend if you have some good medical knowledge in the medical school, you have some good base. Medical knowledge base is to practice questions. I think for myself, the best way to practice, to learn and to study for the licensing exams was practicing questions. I used many banks, and I found it very, very easy to memorize and keep the information in your mind, and you will never forget it if you read the case and then you solve it, you do right or wrong, and then you read the explanation, and then try to memorize the key concept at the end of the case, or maybe write it down. Like, don't write everything, the key concept or the key message from the case. You'll never forget it. That's how I learned. Some people don't like it; they like the books, but for me, this was the best. It really worked, and I didn't need to read much textbooks. I read a little bit during my medical school in the Toronto notes, but that's it. I felt I have some good medical knowledge base. I said, okay, I'm just gonna do questions, and I did tons of questions, like tons. I found it very, very helpful. But it depends on how you retain information and how you used to study. So. I cannot recommend it to everybody, but you can try it, and for myself, it was very helpful.
Coming to the last part, what additional tips would you like to give students?
So for additional, I have some few tips to say for IMGs. If you're a medical student, you have an advantage to do electives. It's very important. Do electives, as many as you can, even if one, or even if couple weeks. Any kind of Canadian exposure or stay in the United States is important to you, and it's very important on your CV. If you've graduated, it's okay. You can go in you can go in the past and do electives. I didn't do electives myself, but I did observership because I was I was already in IMGs. At the time of application, but so I did observership. So do observerships. If you have graduated, if you're still in medical school, do elective, and these will definitely give you a bonus point for your application.
So for your observership, you had to go to Canada, and how many months did you do it?
So for observership, I did only for 1 month, but you can do more or less. But the point is. To have this on your CV, that you're trying to, you're not just, applying and not doing anything, like you're not trying to get an exposure. And the best thing that you can do is to get a letter of recommendation from the person you're observing, because although it's called observership or shadowing, but if you're enthusiastic, if you're you ask questions, if you're trying to learn, they will let you do more than just observing. They will let take history, examining patients, but under their supervision, obviously. But they will trust you and let you do some more stuff under their supervision. And at the end of the observership or the elective, ask them for their feedback. And if you felt that the feedback is good, just go ahead and ask them for letter of recommendation. That's the best thing. If you can get letter of recommendation from a Royal College certified physician or College of Family Physicians certified, like any physician practicing in Canada, it's excellent. It's very useful.
So how do you get into an observership for an IMG? Would they just write to the medical college or?
Yeah, so basically, observership can be, very simple. Like you can just go to a family medicine center, let's say, and talk to, one of the family physicians, and just ask them and tell them that you're, an IMG trying to apply, and you'd like to see how the system works. You'd like to observe him. So you can just do an observership this way, or you can, if you want to do it in a certain specialty, let's say medicine or hematology, or maybe observe some surgeries or something else. You can email the program coordinator or the program assistant of each program. Let's say, give an example. Let's say University of Toronto, for example. You email, the program assistant or the program coordinator of, let's say, internal medicine, and ask them if they can help you organizing an observership. And if not, ask them for resources or who can help you with that. But that's how you can do it. You can do it, as simple as asking a family physician, or just, go straight to the program. And, when you do observership, they will know you. So let's say you want to apply to internal medicine. If you do observe there and you observed, a couple attending physicians, they were impressed and they gave you maybe letter of recommendation, or they were just happy with your performance. I think that's important, but it's not mandatory. Again, it's something that you do to boost your application. The more you do, the.
So if an IMG is suppose he's preparing for the exams from his home country, and he or she would like to apply for an observership, it could be done online, right? They could write an email.
Yeah. You can just write an email, and if they say okay, try to organize it, and go over. There was some in some provinces. There was some IMG organization that will arrange observerships for you, like in Alberta, for example. It will help you to organize observership for you. It's like a non-profit organization where IMGs can study in groups, and they can help them with arranging observerships. But it depends province by province. But the easiest way is just to email programs and ask them. Email the program coordinator and ask him.
So what about IMGs who are not citizens and who don't hold a current visa? Should they apply for the visa first, or should they apply for PR? How would the steps be?
Oh, you mean if they don't have if they don't have a PR yet? So for most programs, to be eligible to apply for IMG spot, you should have a permanent residence, or a landed immigrant, or a refugee, or have some legal status in Canada. You cannot just apply as a totally foreign person without anything on board. The only way that this can be done is through international funding, government funded spots, where some governments like Jordan, Saudi Arabia, they send residents and fellows to do training in Canada. They get matched through a different pathway, and once they finish the training, they go back home and practice home. They cannot work in Canada. That's the only way that I know of. But if you want to get matched as an IMG, you need to have some legal status, and it's stated very clearly in the Carms website. It's one of the basic requirements to have a PR, or landed immigrant, or.
What is the second one? Landed immigrant. How do you define
which is basically it's just immigration papers. but it's basically the same as PR. But you have to have some legal, like settled legal status there. It's you need to have some legal, like you cannot just apply with your foreign nationality. Yeah.
For example, you can do that for the U.S., but you cannot
exactly.
do that for Canada.
For the U.S., you can apply. So that's the trick in Canada, right? So thanks for bringing this up. So that's one of the important and big differences. As in the U.S., you can apply with your foreign nationality, and you get accepted. You apply for a visa, a working visa, or I don't know. I'm not very familiar with the process, but the J1 visa or whatever, and then you start working. But in Canada, no, you need to have some a PR or.
Okay. So what about research experience?
Research experience is very important, and you don't really it's again, it's not mandatory. For some programs, it's extremely important. For some programs, they'll say, I don't care if he did or if she did research in the past. They can do research as they go through their training. So it's not mandatory. But if you have any kind of research experience, it's very, very important. Even if you don't have like a publication, just a research exposure is good. You can put it in your CV, like what are your research interests, what are you doing, and yeah.
So it could be any type of research. For example, it could be clinical phase 1 to 4 trials. They were just observed.
Yeah. It doesn't have to be even trial. It can be just a case presentation, like in like in a research day, let's say, or it can be like a case report, a case series. It doesn't have to be like a big study, right? You're not expected as a medical student or just like a fresh graduate to have like a big study.
Or even participation in one of these international conferences.
Exactly.
Even that is
Yeah. I don't think it's gonna be considered as research experience because it's a conference. But any kind of exposure is good in research. If you have, or if you could help someone doing research and you get your name on a publication for a case report or for a case series or maybe for a bigger study, that would be extremely helpful. So but it's not mandatory, but if you can do it, if you have the time, most of us will be busy with studying for the exams and trying to get things organized, so it's not easy to do everything, but if you can, and especially if you're aiming for a very competitive subspecialty where they take only a few in a year, then I think you should do some sort of research, or at least be exposed to something to be more competitive and to get the specialty of interest.
What about the interview for the residency program? What are some of the common questions you can
ask? That's another thing. So please, when you're invited to interview, don't just say, oh, okay, I was invited, they want me, and I'm accepted. You should really prepare for your interview, because there is part of your evaluation, part of the points you get that goes towards your total points is on the interview. So prepare for it well, and try to practice some questions with someone who speaks English well, or where English is his or her native language. But one of the questions that they can ask you, just try to think about them, like why do you want to apply to our program? That's what they might ask you. Why this province? They can ask you, why did you choose this specialty? What's your previous experiences? What are your goals? What are you planning to do in the future? What are your future career plans? They can ask you, some tricky questions sometimes, like what would you do if you had a conflict with during your residency, or you had you disagreed with the fellow resident or with your senior resident, or for example, if your senior resident, is doing something that's, not 100%, right, like, not, not giving the best treatment for the patient, what would you do? They might ask you, they might.
Is there some standard answer for that?
I don't think there's, best answer, but there is a way to, try to not to be, not to take only one side. Yeah, try to be flexible in your answers always. And if they tell you something else, try to think about considering. Don't try to look rigid, and that's what that's your answer. That's it. Try always to be flexible, and that you're learning. And you can say, if my senior resident is doing something that's not maybe the best of care, but is not dangerous, I would discuss it with them or bring it to his attention. Like they want to make sure that you're safe to be in their program. But yeah, so like that's I think the way to kind of answer it. And they can ask you about your strengths, your weaknesses, and some standard questions as well. But again, when you apply, just make sure to read your CV before the interview. Like if you're invited to an interview, the night before, read it well and know exactly what's in your CV, because they can pick up on something and talk about it. So they can ask you about your hobby. If you said, I play tennis, and you never played tennis, that would be a real embarrassment for you, and they will not, be confident. They will not trust you anymore if you're lying with simple things like hobbies. So just know exactly what's in your CV. Don't let someone write it to you. And if someone helped you with it, just read it well and make sure that really reflects your personality, reflects your experience. And because they can pick up on something and focus all the conversation around it and forget about all the standardized questions. Yeah.
Is there a standard format for CV?
There's no single form, but there is there's a few. But you should always look online for some samples, and it's always good to do that. And
so from the top of your head, how many pages do you think the CV should be? Should it be a long one or a short one?
So it should be short. It should be like no more than 2 pages. But again, if you're a superstar where you did tons of applications and have some experience, you've worked in different places, then it's not reasonable to be maximum of let's say 3 or 4 pages. But never more than 4 pages. More than 4 pages. Yeah. And don't mention like things that are not relevant, because they will then lose focus, and then they will forget about the important accomplishments that you've done in your life. So you want them to,
That's a very good point, actually.
Yeah. The longest the CV, the more they're likely they're not gonna read it. But if it's short, they will, look at the important stuff. Put your accomplishments, in the first page, and they will look at it, and it makes a difference. If it's too long, no one will read it. They don't have time. When I applied, I didn't have my name on any publication. But during my residency, now I have my name in many publications. But it's not a requirement. I got matched without any publication. I did have some research experience, but not a very strong experience. Just some research that I helped with back home. But that's it. So it's not a requirement. It's an extra thing. If you have it, that will give you a boost for sure.
And one more thing I wanted to ask you was about the different provinces.
Again, if you're interested in one province and your whole family is there, and you're trying to match there, go through Carms, and then go to Provincial requirements and read the requirements. And sometimes, you'll hear lots of stuff from different people, oh, you should do that, you should do that. And when you really, ask people who went through this, or just check the Carms website and read it well, there's no such thing. Like some people, exaggerate sometimes. Some people are, very pessimistic. They'll be like, oh, it's impossible to get match in Canada. Just forget about it. No, it's not. Like, lots of people are getting match every single year. So it's not impossible. It is competitive, but if you're really interested in one program, you should read about it. And there's, like in British Columbia, I think they have some requirements, for you to be there, I think, or to have to take like standardized exams like the NAC OSCE, but something different for them. So always read that, but try to apply everywhere. And even if your whole family is like, let's say in Saskatchewan or in Newfoundland, apply everywhere. Don't say, oh, I'm just gonna apply there because my family is there. Apply everywhere, and then when you get match, there's always way. If you really want to move, they can help you. Once you're in the system, everything gets easier. Like let's say, you just want to live there. You can do a couple of years of family medicine in other province and go back and practice where your family is. Even if you got matched to like a 5-year specialty, like anesthesia or to internal medicine 3 years. After during your first year, you're in the program and things are okay. You can talk to your program director and be like, I really want to be beside my family, and they can consider switching you or transferring you from program to program where your family is. So things get much easier and much more flexible once you get matched. So try to match anywhere, and then after you can talk about the details. But once you get matched somewhere, it's easier for you and much easier later on.
So that brings us to the end of the interview, and I really wanted to thank you for taking the time and sharing so much of valuable information so freely.
Oh, my pleasure. Yeah, no problem.
Thank you for taking the time to listen to the interview. If you want to find out more about our services and resources that can help you get a high score in the MCCEE, MCCQE, and USMLE exams, then go to canadaqbank.com. Our services include the comprehensive high-yield Qbank that closely simulates the questions encountered in the actual exam. Canada Qbank has been in business for 5 years and has hundreds of success stories to its credit. Our Qbanks are continuously updated to reflect the changes in the testing patterns of medical licensing exams. So coming to the end of the video, I hope you found the information very useful. Post your comments below and let us know what you think and what you would like to know more about, so we can create more interviews for you. We want to hear from you. Share the videos with your fellow aspirants and colleagues, and wishing you the very best for your career. This is Dr. Stephen Anthony from Canada Qbank. Bye-bye.